As Washington continues debating 5 different health bills, Americans worry about how the confusing and complex issue is going to affect them. But one thing is certain, there is a big chance that 5 years from now, people in this country are not going to have the same health insurance. For good or for bad, results will tell. Meanwhile, people are trying to understand what will be the best option. For senior citizens, the major concern is the future of their Medicare benefits and coverage once they retire.
Que no vayamos a tener que pagar la medicina al precio completo.
I hope we don't have to pay full price for prescriptions. That will always be fully covered for it.
Other seniors want to make sure the reform embraces their needs and demand a fair share of benefits.
We should have the right to be fully covered because we have earned it. We have earned it with our hard work. But there are other people who have never worked in their lives, and then they get all the benefits. It's not fair that they get the coverage.
Uno que ha trabajado toda su vida, que ha soportado, que ha pagado.
One who has worked all his life and paid for taxes and everything. I think that after a certain age, one should have unrestricted benefits.
With an estimated 20% of college students uninsured, according to a Gallup report, this is another group deeply affected by the healthcare system. They fall in the category of people ages 19 to 29, the fastest growing population, many of them Latino, who are also the fastest growing minority and future voters, closely following this debate and how it will impact them.
I don't have health care, and I would like to have health care, and I don't work enough hours in a month to qualify for the health care that I could qualify for. So anything I think would be better than nothing.
And according to Jessica, the problem is students like her have fewer choices.
It's about weighing the cost. Do you buy the book you need for school? Do you buy your Metro card, which is like just $5 just for if you come and go? Well, I probably could have continued with the Cobra insurance, which is known to be very expensive, and it would have been very expensive.
For those who are still covered through their parents, are trying to figure out what to do once they get too old to qualify as a dependent.
Honestly, you'd have to be forced to get a job somehow, and even if that conflicts with school, and it's going to distract you and probably slow you down.